Hello and welcome to the Health from Zanzi podcast, where we explore the stories of those transforming the world of health and medicine. I'm your host, Dawn Mdu, and today we're exploring the inspiring journey of Zahida Shaikjee, a physiotherapist and integrative movement therapist with over 30 years of experience. Zahida blends physical therapy, yoga, and mindfulness to promote holistic healing. Greetings, Zahida. It is absolutely amazing to have you join me here on the Health from Zanzi podcast. I am so excited to be chatting to you about your journey within the healthcare space, but also just holistic care for the self. I think is really a big part of what you do. Welcome to it. Thank you so much for joining me.
Hi, Dawn. Thank you so much for having me. I truly appreciate the time and the space you've given me, and I look forward to chatting with you.
Now, I usually like to start with my guests telling me a little bit more about themselves. Where did you grow up? A little bit more about your family, a bit about your childhood and your own family. Just like more about you as the person before we get into the work that you do within the healthcare space.
I was born and bred in Johannesburg, and I did my schooling and my tertiary education there. I studied at Wits as a physiotherapist, but did 2 years of BSc, using that as a stepping stone to get into physiotherapy, and then started my working career in Cape Town. So Cape Town's my adopted city, and I worked in Cape Town for just under 3 years, and then left to work abroad for about almost 12 years before returning back to Cape Town 18 years ago, believe it or not. That gives it away. I've got 3 decades of professional experience and try and integrate all of what I've learned in various places to service my clients. In terms of my family, I'm part of a blended family in that my parents, they divorced when I was 16. I've got a twin sister and a younger brother. 3 of us are in the medical profession. My twin sister Zakira is a pharmacist, and then my brother's a doctor. And then my parents remarried, so I've got 2 sets of families. My late parents now, they both have passed on. My mum fairly recently. And they both remarried, and my dad had a daughter from his second marriage, and my mum a daughter and a son. So we actually blossomed into 6 from 3, and I can't imagine life without my other siblings as well. In terms of my own family, I have delightful nieces and nephews, no children of my own. I'm happily single.
Your family, Zahida, is such a big part of who you are, the love and the care that you show to them. It's so amazing that you and your twin sister and your brother all in the field. Did someone push you to all pursue a career in this specific sector? You can share the moment or what inspired you to a career in physiotherapy.
I have to say my dad and my mom as well, but truly my dad had the insight to recognize, because we come from humble beginnings, he was always encouraging of education and always said education is our key out of poverty. He was so wise, because I know at the time it wasn't easy, but he and my mom really worked so hard so that the 3 of us could educate ourselves. My dad always had the dream to become a doctor, but it wasn't possible. So it was wonderful for him to be able to realize his dream through his son becoming a doctor. And it just turned out that we ended up doing what we're doing. I always jokingly say, whenever my parents were in hospital, that they come in with their own personal medical team.
I love that. Maybe if you can share, some of the most common misconceptions that people have about therapy and its role in care.
The one big misconception is one has to be touched, and the main thing most people will say is, as soon as they hear you're a physio, is, oh, I need a massage, the soft tissue work that needs to be done. And of course, there's a place for that, but there's so much more to physiotherapy than just soft tissue work. I also say that now with so much of conviction, because I've evolved as a physio and I'm now integrating movement, breath work, visualization into my practice. and also doing online clients that are abroad and locally in South Africa. And so I can very firmly commitment say that you can heal through different modalities, and not necessarily do you have to be touched in order to be healed. It is quite exciting in the way I've evolved. And I do feel the way when one is, for example, moving on the mat, being guided with mindful movement, incorporating your breath work with the movement, quietening the mind, working on visualization, that then lends itself for the person to heal much more than if I had them on the plinth, which I did for many large part of my professional career before I started doing the movement-based therapy. But once a person's on the plinth, it's more passive, it's hands-on, and it's rather the therapist giving the treatment and the client or the patient just simply receiving it. There is a benefit, but it's not as sustaining and long-lasting as it is when the patient or client is moving themselves actively on the mat in the session. There's an enormous difference between the two. So I think that's the big misconception, that one has to have soft tissue work in order to reverse dysfunction and decrease pain. But as you can hear, there are other tools that one can use that are far greater in how it significantly improves not only the physical body, but also the mind, which is ultimately the most important.
Thank you so much for sharing that and kind of your experience, moving or transitioning from one area of your work to another. It is quite interesting to kind of see it and how you've changed your approach to the work that you do as well. In your experience, what are some of the most rewarding and challenging aspects of being a physiotherapist, and even more the work that you're doing now, this integrative movement-based therapy?
What's most rewarding and so fulfilling is visibly being able to observe and notice on a client's face, or when they're getting up from the mat, just how different they're feeling and the expression on their face, and just how fluidly they move after the session. I have to say that for me is so fulfilling, because I know they've shifted and transformed in what it is they've done. But more importantly, it's also given them the ability to know that they're now empowered to do whatever it is I've guided them through, be it with the breath work or the specific movement that they're doing. They can do that on their own and be their own healer. So that's most rewarding and fulfilling. Of course, also noticing, because I service a retirement village in the area, I work with some delightful 70-year-olds and 80-year-olds, even a 90-year-old, and just being able to see how their functional activities improve as I'm working with them. For example, getting them from maybe being semi-bedridden to being able to get them to walk, to being able to do the activities of daily living that we often take for granted in terms of showering, getting dressed, feeding ourselves, all of that. So be able to see how that changes, and obviously noticing their appreciation and gratitude, because it's instilling independence for them. Those are the key points. It's rewarding. In terms of what's challenging, I'd say having someone come in with the idea that they need to be treated in the conventional physio way, I'll say in inverted commas, with being on the plinth, being massaged, passive range of motion, and it's more of a passive treatment rather than active treatment. So not recognizing that we have to work together as a team for a shift to happen. And for some people, they haven't really reached that as yet. So they come in with the preconceived idea that they need to be treated in this routine kind of way, and then only they'll feel better. And sure, they do, but it's temporary. It's not long-lasting, and it's not sustaining. So I think that's one of the challenges one is faced with. But I think that's where education comes in, and also encouraging patients to trust themselves enough to know that we have this amazing body that's been gifted to us that has so many amazing properties, including internal healing properties. And we can tap into that and then heal ourselves. We don't necessarily have to go the pharmaceutical route all the time.
I think key takeaways from what you shared for me was your work that you're doing, more elderly people, more senior citizens. I commend you for that. That's definitely, what we love to showcase here at Health Forum Zanzi. Often our senior citizens are almost forgotten. And for me, that is really something that I feel very strongly for. So grateful for the work that you're doing in that area specifically, with an increasing focus on what is referred to as preventative care. What role do physiotherapy plays in helping people maintain long-term health and mobility so that it doesn't get to a point where you're really not able to move? Or, as you get older and they're keeping up with movement and, your body and how it's changing. What advice do you have in terms of that?
A very good question, especially since for in the initial part of my career, I can say that more often than not, I'd say 98% of the people mostly obviously coming in with some form of dysfunction, pain, and imbalances. So that we try in terms of education to afford them the opportunity to avoid having these injuries. But regretfully, if it's not holistic and it's not comprehensive, more often than not, the treatment is not complete. So by that I mean, when we're talking about preventative, you're wanting to ensure that you are recognizing that the body is everything from the crown of your head to the tips of your toes. And if you are doing any form of rehabilitation, you need to consider that every moving part is linked to another moving part. So for example, if you have knee pain, recognize that if the treatment is only centered around the knee or above and below the knee, just around that specific area, and the whole limb is not addressed, and the spine is not addressed, not necessarily will you clear that person from the knee pain, because you can get symptoms coming through from the spine, through the pelvis, into the lower limb that's affecting the knee. And more often than not, I'm using the knee as an example because it's a very common joint problem. More often than not, if I've assessed clients, I've noticed not only the knee is the painful area, but it's because either they've got an unstable ankle joint or they've got a stiff hip that's now forcing the knee to do more work than it should be doing. Because this is the amazing part of our body. It will perform the tasks that we ask of it, but it will do it through the path of least resistance. So it knows you're wanting to perform this task, perhaps walking. So it will do that, but it will do it by recruiting other areas above and below to help you complete that task if it can. If it can't, then you end up having a problem in that specific area.
Constant monitoring of what you're doing, and I think continuous movement is also important. Walking.
Very much so. Preventative care, I found it's a mindful movement, conscious breathing. It's taking time out of the day to just pause and be still. Everybody is so busy, and a lot of the dysfunction, imbalances that we're seeing in our bodies is as a result of that busyness, not taking time out. We're not managing stress very well. So I would say the key points would be mindful movement, conscious breathing, visualization, and just taking time out to be rather than do.
That's so vital. And honestly, as someone who wasn't very active growing up, I wasn't very sporty. I didn't really do a lot compared to
Neither was I.
hearing my brother on, he's active. But I was a little lazy. But as I grew older, I started enjoying it more. We walked as kids. My parents, always encouraged us to go hiking, swimming, but just movement is something that I'm grasping a lot more now. And I think it's so important to get.
Very much so, Dawn. And you touched onto something there, saying hiking. We're so fortunate and blessed for those of us that live in Cape Town. It's one of the prettiest cities in the world. And you've noticed from my bio, I've traveled a fair bit. And I can say this without conviction. This is one of the prettiest cities in the world with the natural beauty that we've got. We've got the mountains, the forest, the ocean right there. And that in itself, just being out in nature, that in itself is so healing. Better than being like in a room with four walls. There's just something magical about being out in nature, putting your mat down and then just moving, listening to the birds, the breeze over your skin, maybe some running water close by. All of that just adds to that magic. And that works wonders for the mind. And then, of course, resets the nervous system, and then you start healing.
That's definitely true. I felt it and I feel it, and I'm very privileged, I must say, and I'm so blessed throughout my life and even now as an adult. And I actually wanted to ask a bit about your travels experience, working as a physiotherapist in different countries. You've worked in South Africa, you've worked in Canada, you've worked in Saudi Arabia. How has it really influenced your approach to integrated movement-based therapy?
The wonderful thing that I did have is that I was able to work as a physio when I worked abroad. But the big thing is I got this amazing grounding at Skier, because that's where I started my working career. And I had almost to work there for just under 3 years. And then I went abroad. So when I worked in Canada, I worked in 2 different places. I started off in Winnipeg, where the temperatures would go down as low as -40, Dawn. I was in the prairies, and then snowfalls in abundance. And I worked there initially for 5 years. I worked at a tertiary center there, which was again amazing because I got experience in all the big key areas of physio. Because physio is similar to medicine in that you can specialize in pediatrics, in orthopedics, neuro, respiratory, all these different areas you can specialize in. I was grateful that I was able to get experience at Skier and in Canada in those big areas. I'm experienced in all the disciplines under the umbrella of physio. But my speciality is orthopedics. That's where I've done most of my postgraduate courses. Having said that, I worked in Winnipeg for 5 years, and then I relocated to Toronto, and I worked there for a year and a half, also in a semi-tertiary center there. So I was lucky. I worked in both Saudi Arabia and in Canada. I worked tertiary centers. They were big hospitals, fairly big hospitals. And then in Saudi Arabia, I went from -40 to +40 in the desert now. I worked in Jeddah for 4 years. And then in each of those times when I changed places in each of these countries, I would come home for about 9 months and then return. And my last stint I did at Saudi Aramco, which is in the eastern province of Saudi Arabia. It's in a place called Dhahran. So that was the last stint that I had there. I think the way it shaped me was I worked differently in both of those countries simply because when I started working in Saudi Arabia, I didn't know Arabic. Conversational Arabic. So I struggled in the beginning and then, of course, started learning the language. But because of the system there, a lot of the therapy that was administered was more passive. And in Canada, it was a combination of passive and active. When I came back to South Africa, for the initial 10 years that I was here, it was similar to how it is I worked in Canada. And then as I started getting more involved with doing my yoga teacher's training and the Thai yoga massage, beginning to become more curious and intrigued by the way the body moves on the mat and combining both my scientific evidence-based knowledge that I've got from physio and this newfound knowledge, I started integrating the both of them, coupled with my previous experience, to try and give the best that I can afford to give my clients with all that I've gathered over these years.
You've kind of shared with us the different areas where you worked and getting into a little bit about what you did in these respective places, and it sounds really amazing. What inspired you to kind of combine physiotherapy with yoga and other therapeutic practices like Thai yoga massage, and how the different areas kind of works for you now with the current work that you're doing?
I chose to do the yoga teacher's training more for my own personal growth when I started doing it. And then as I was talking about it to my clients, I had one, and I wasn't intending to teach actually. That was my own personal thing that I was planning to do for myself. But I realized as I was moving on the mat, the way I was doing my rehab with just my physio cap on was limiting because it wasn't allowing for everything to come into play with the body working harmoniously from the crown of your head to the tips of your toes. When you're working and moving through postures on the mat, everything works together when you're on the mat. But if you're on the plinth and I'm giving an exercise on the plinth or my physio bed, or I get the person to stand up and do an exercise in standing, it was very limiting. I realized that there was a limitation there. So I started changing the way I was doing my rehab and how I was teaching my clients. And I remember clearly there was one patient of mine that said to me, I should start teaching. And it took me 9 months before I actually decided I need to do this. She nagged me long enough to do it. And I'm so grateful to her that she persisted, because that was then the beginning of me completely evolving as a physio. And then when COVID hit, I can say without a doubt, I wouldn't have been comfortable doing tele-rehab therapy with my clients, which we were allowed to do over the period of high periods of lockdown. All practices had to close. So we had to go online and do tele-rehab. And it was at that point that I realized I was so grateful that I was able to now shift my clients without having to touch them, because I was teaching them in a different way on how to move. More importantly, too, I was connecting the mind to the body using the breath and visualization, because one cannot heal if your mind is in chaos. And you also can't allow for your muscles to efficiently work if you're not oxygenating them well enough. And more often than not, most people are not breathing expansively, consciously. And most people are very busy in their minds. So they come into the practice and they're already all over the place. And now here am I working on them, and they're not settling them down. I realized wasn't ideal. So now, without a doubt, even if I just take 5 minutes, I will take that 5 minutes to do centering and grounding work and just get my client to be a bit more relaxed before I start doing the rest of my therapy, because now I know they're also more receptive to engage with me. Because as often I found, especially when people are holding very high position at work, they're managing many people, as soon as they come onto the mat, I can already see their mind's monkey mind. And you can't do anything when your mind is full. You need to have that cleared first, or at least semi-cleared, before you start doing the rest of it. That's what then inspired me to continue. And all of my courses that I do now, thankfully, there's no geographical boundaries now with online. So a lot of my courses I do is from people that I follow that are abroad. Those online courses, I do very few and far between physio courses as such. I did a lot of that when I was in Canada, South Africa initially, when I started my working career, and when I was in Saudi Arabia, I did purely physio-based courses. Now, because I've evolved, my continuing education has also transformed and changed. So I'm doing it with the idea of more holistic, integrative management.
Thank you so much for sharing parts of your story with us. It sounds really amazing. And just in terms of the work that you're currently doing and how people can get in touch with you, and also kind of what message you would like to share with your fellow colleagues in healthcare, but also just the general public listening to this and being interested in more of the work that you're doing. Any closing statements, any last remarks from your side that you'd like to share? And how can people get in touch with you? I mean, I'm so much looking forward to coming and experiencing some of your sessions.
Our mind, body, and spirit are not separate entities, but part of a whole. We need to take care of the whole to function efficiently and well. We also need to remember true power is living the realization that you are your own hero, healer, and leader. I really think that's important, because most people have forgotten that we can take care of ourselves if we guide it in the right way, and we have the tools to help us with that. In terms of getting in touch with me, I'm busy working on my website finally, Dawn. It's taken me a long time. So my website's not up and running as yet, but it will be soon. The website is my initial ZS, physioyoga.coza. I'm happy to share my cell phone number if anybody wants to contact me via WhatsApp, 082-502-3153, and I can be reached on that number. My Instagram handle is simply my full name, Zahida Shaikjee.
Thank you so much for sharing your story, Zahida Shaikjee. I love that you've combined traditional physiotherapy with yoga and mindfulness. She, of course, believes that true healing requires balancing the physical and emotional aspects of well-being. Her work helps clients reconnect with their bodies and find lasting relief. Her story reminds us that healing is about more than treating pain. It's about balance, mindfulness, and meaningful connection. If you've enjoyed today's conversation, be sure to subscribe, rate, and leave a review on your favorite podcast platform. Until next time, greetings from me, Donumdu, our technical producer, Megan van de Vent, and the rest of the #Team Health from Mzansi. Stay inspired.